Hi, welcome to my channel. So today I want to talk about a new topic. It's about type 1 diabetes mellitus. The abbreviation is T1DM. So before we begin, let's start with the purpose of this presentation is to understand the definition of type 1 diabetes mellitus, etiology, the symptoms, the risk factor, pathophysiology, the diagnosis, intervention, and prevention. If there's no prevention for type 1 diabetes, so there's lifestyle changes. So let's begin with the definition. But before I explain the definitions, I just want to inform specific about statistic data that the Australian Institute of Health and Welfare reported that 3,000 newly cases diagnosed with type 1 diabetes mellitus in Australia in 2021, and there is no vaccination against type 1 diabetes. And according to the Diabetes Australia scheme, it's a government scheme. So type 1 diabetes mellitus is an autoimmune disorder where alterations to pancreatic beta cells of the adaptive immune system inside the pancreas, it underproduces or misproduces insulin production, which is incompletely cured and it's lifelong. And type 1 diabetes mellitus trigger children and adolescents and people at any age, and basically common to individual under 30 years old. So it's an autoimmune disease, which means healthy cells attacks its own body system. So the etiology or the root cause of diabetes mellitus, it's unknown. So it is unknown that it can cause type 1 diabetes mellitus, but the inherited gene that is susceptible to type 1 diabetes, and in addition to environmental triggers, infections, and stress level contribute to type 1 diabetes. Pancreatic duct obstructions, if you look at the anatomy of human organs, the pancreatic duct obstructions, it leads to diabetes because of the pancreatitis, the inflammation, and the obstructions. And that's why it affects the insulin-producing cells. And I will discuss this later in the pathogenesis of type 1 diabetes mellitus. But we need to know what are the risk factors influencing type 1 diabetes. The risk factors include excessive sugar consumption in diet and refinery foods, severe infection that alters the immune system, specifically the adaptive immune system. It attacks the beta cells and helper T cells. The environmental triggers from urine transmissions by sharing the same toilet or wet seats contains patient urine. The combination of genetic and virus infection, sharing and using the same household products. Examples like toothbrush, spoon, drinking straws, or cups with the patient. Or unprotected sexual transmission, also influencing the development of diabetes. Glucagon hormone dropping because of the pancreatic alpha cells in the pancreas. It cannot produce glucagon or secret glucagon hormone, so it's causing lower insulin production. The risk factor also transmit from patient blood, saliva, urine, and bodily fluids. Medication side effects that lower the glucose level, inherited genes that are more susceptible to type 1 diabetes, including the HLA-DR gene and the HLA-DQ gene. HLA refer to human leukocyte antigens. And family history of having type 1 diabetes mellitus or type 2 diabetes mellitus. These are the risk factors influencing type 1 diabetes mellitus. What are the symptoms of the diabetes? So type 1 and type 2 symptoms are similar. The Diabetes Australia confirmed the symptoms of type 1 diabetes mellitus, including excessive thirsty, excessive urination, or commonly in children, fatigue, tiredness, and appears lethargic, always feeling hungry, prolonged healing wounds or cuts, skin infection or itchy, blurred vision, unexplained weight loss, mood swings, headache, feeling dizzy, and leg crampings. These are the symptoms of having type 1 diabetes mellitus. So I explained a little bit more about the clinical manifestation, that the glucogenolysis hormone and gluconeogenesis hormone, they are unable to secrete in the pancreas from the liver because it's caused the lower insulin production, which means dropping glucose level in unmanaged or cannot control glucose level in the blood. It makes the person feel more hungry, sweating, and thirsty. The person becomes excessively thirsty due to hyponatremia when the water level is insufficient, leading to dehydration and hypotension. So the patient may have symptomize as fatigue, dizzy, and blurred vision when diagnosed with type 1 diabetes. Human blood composition contains platelet and plasma for wound proliferation. But when immune system triggered by the infection, it releases the prostaglandin chemical release, which is the sugar, and prostaglandin cannot produce sufficient hormone to improve wound proliferation. So prolonging wound cut proliferation, which means patient with diabetes should not undergo surgical procedure or cuts because the wound healing is taking longer than expected. Skin integrity is necrosis due to dehydration, affecting skin membrane to dry and prolong wound proliferation too. Unexplained weight loss when there is insufficient insulin production, causing excessive hunger, and nutrition cannot absorb glucose into or send glucose by bloodstream, leading to dizziness, hunger, fatigue, and lethargy. Musculoskeletal system affected below insulin and glucose level in the body to support muscles function. It will trigger the patient to appear to have legs cramping or muscle spasms and tiredness. So these are the clinical manifestations linked to the type 1 diabetes mellitus symptoms. In emergency cases and comorbidity, the type 1 diabetes mellitus can develop into diabetic ketoacidosis, known as DKA. It means when the blood acidic the blood pH become acidic due to high ketone level, and it leads to hyperglycemia, like high sugar level. Metabolic stress and insufficient insulin causing body's immune system to become resistant to insufficient insulin. That's when it leads to double diabetes. So type 1 diabetes then develop to type 2 diabetes. And it happens to individual with obesity. When insulin production is too low, causing glucose dropping, it leads to hyperglycemia as well. So which means the type 1 diabetes also can affect make the person's dropping sugar level too low. That's when they becomes fatigue, thirsty, sweating, and nausea. There is insulin in the interstitial fluid of the brain in conjunction to hypoglycemic episodes. So when the sugar level dropping and the insulin inside the brain, it becomes debriefed. So like it debriefs the nerve system. So it causes the person fatigue, tiredness, and hyperglycemia causes toxic stress to the nerve cells, degenerating neurological function. So it leads to insulin resistance and cognitive decline, which is why people with diabetes are prone to develop Alzheimer's disease or delirium, specifically in elderly patients. What are the pathophysiology of type 1 diabetes mellitus? So type 1 diabetes mellitus is an autoimmune disease. It occurs when human T cell of the adaptive immune system commands self-attacks onto beta cells of its own adaptive immune system in the islet of Langerhans inside the pancreas. So in simple way, it's when the pancreatic beta cell got destroyed. So when the pancreatic alpha cell secret glucagon hormone to produce more insulin production, which is the to control glucose level, it converts into glucose or human energy. The cell sabotaging of the adaptive immune system, causing destruction to cytokine releases and other antibodies present. So the pancreatic beta cell got destroyed and it cannot produce any more insulin production inside the pancreas. Then that's when it causes type 1 diabetes mellitus. So what are the diagnoses of type 1 diabetes mellitus? Include blood test. What I mean by blood test here is the blood glucose level check. So checking the sugar level. So again, the normal range of blood glucose level should be 4 millimole per liter to 8 millimole per liter. But for those with 5 to 7 millimole per liter range should be on pre-diabetic medication to control the diabetes, to prevent it develop into the actual diabetes. Ketone level, we're checking the ketone level exactly to check the source and nutrition and should less than 0.6 millimole per liter as a normal range. Complete lab test or full blood count, including the CRP, like to check any infection. Like the normal range is 3 to 5 milligram per liter, and ESR to observe any inflammations and how the red blood cells are dropping or increasing. So it should be less than 20 millimeter per hour to be normal. Other antibody tests, because the type 1 diabetes mellitus is an autoimmune disease, so patient may need to order antibody tests to diagnose to check the normal range. If it's negative, it means it's normal. C-peptide protein test, known as CPP. The C-peptide protein test, it's used to observe the insulin production in the pancreas. So again, these CPP tests can observe how much insulin production inside the pancreas can produce, or how much do we need insulin. Pancreas biopsy is a rare diagnosis, but it can also observe if the patient have alterations to the pancreas function. Urinalysis can check where urine test to observe any infections and sugar level inside the urine. A1C test to observe blood sugar level over the past 2 to 3 months after diagnosis. So in the normal range of A1C test is below 5.7. If more than 5.7%, it means the person is pre-diabetic or diabetes. So these are the diagnosis for type 1 diabetes mellitus. So the interventions include medication. I'm just gonna explain a little bit about insulin here. Insulin injection and insulin pump. Insulin cannot use as a tablet or oral tablet. It may digest into building block of isomers, amino acids, causing to be inefficacy. So this is not in this clinical details. I'm just explain what I have done research on. So insulin injection and insulin pump, there are like 5 types of insulin. So if you understand each type of insulin, it's good that for people to understand better about the type 1 diabetes mellitus. So type 1 is the fast-acting insulin. It appears in a clear appearance, and it takes effects within 20 minutes. It lasts 3 to 5 hours. Again, insulin is a type of medication that used to control glucose level in the bloodstreams, in the human blood. So, however, insulin is also act as a ligand, which is a natural pathway that produced by our cells, which is the pancreatic beta cell. And type 1 diabetes, again, is an autoimmune disease, so beta cell got destroyed, so there's no insulin production to produce anymore, so glucose level cannot be controlled. So when we eat more sugar in the diet, it will elevate the sugar level. So the next type of insulin is short-acting insulin. It clear appearance, and it take effect within 30 minutes, longer than the fast-acting takes only 20 minutes. The short-acting insulin lasts 5 to 7 hours. Immediate-acting insulin, it appears like a cloudy appearance. Usually they add protein and zinc to delay its effect. It takes effects within 1 hour and a half, and it lasts up to 24 hours. The long-acting insulin has a clear appearance, slow action onset, and lasts up to 24 hours. Mixed insulin, cloudy and clear appearance, injecting before or after meal. It depends on the patients and conditions. And again, the effect lasts longer than the long-acting insulin. So there are 5 types of insulin. And the non-pharmacological interventions is not simply managing much on physical, sensory, or therapy, but it's on lifestyle changes. So to change the diet, improve physical exercise and sleeping patterns, and can take regular medications. But this part for type 1 diabetes mellitus, there's no specific oral medications to reduce or drop, because type 1 diabetes cannot be prevented. It's incompletely cured and lifelong. So if you diagnose with type 1 diabetes, it sounds more severe than type 2 diabetes, because type 2 diabetes can be prevented or slow the progress. But for type 1, it cannot slow down the progress and cannot be prevented. So you may need daily insulin injection or pump. And again, there is no surgical procedure for type 1 diabetes. So the preventions, it refers to lifestyle changes. And here I did research on the Australian dietary guidelines. They recommended healthy diet to prevent type 1 diabetes mellitus with 5 food groups. Group 1, vegetable and legumes, if I pronounce correct or not, and beans. Group 2, fruits. Group 3, whole grain food like bread, cereal, brown rice. Brown rice can reduce carbohydrate and glucose contained in carbohydrate. So brown rice is recommended, and pasta. Group 4, lean meat, fish, poultry, tofu, tempeh, and nuts. Group 5, calcium fortified plant alternative products include milk, yogurt, cheese, and non-dairy. So ensure lower carbohydrate levels in diets. lower unsaturated fat in diet, lower the packaged food, replacing with whole meals, eat regular meal patterns, simple exercise recommended people to take stair instead of lift, avoid prolonged sitting, discuss with dietitians and doctor before having physical exercise routine assessment for diabetes diagnosed patient. And people may spot it that their wound or cuts healing take longer than expected. So surgical procedure is not recommended for those who diagnosed with diabetes. And references available on Pamika. Thank you for watching. And this is it for type 1 diabetes mellitus. And see you in the next video with type 2 diabetes mellitus. And